Right, ladies and gents, Al's medical minute. Obviously, it's going to go on for longer than a minute. What he wants to talk about today is rough and ready, in the field, very realistic burns. Now, the best treatment for a burn is not to get one in the first place. And here we see the Cook's Essentials gloves. I've shot you a pair on that, mate, yeah? So, ladies and gents, this is what we've done our brewing. Hot ashes, very thin stainless steel. That thing is going to be hot. But so, let your eyes be your guide on these. There you go, ladies and gents, and I'm holding it, and I'm holding it. I can feel it getting a bit warm now. Oh, actually it's quite nice warm, because it's cold. But there you go, ladies and gents, that's it. And again, you know, we'll get in there. Look, the hot ashes, you not really want to do that with a even your leather gloves you were wearing, the yellow ones, you know, the bushcrafty ones. Cook's Essential, in the order of, you know, like 15 to 17 quid. It's got to be done as far as I'm concerned, because there's two things you're going to do out here: cut yourself and burn yourself, ladies and gents. Let your eyes be your guide. I ain't getting on, I'm not on any kickback from these, but I can pick that up and hold that. And there you go, ladies and gents. So that's a quick introduction. Just a, well, the best way to treat a burn is not to get one in the first place. Let your eyes be your guide. I'll drop a link into them gloves. Like I say, I bought mine, I paid for them, wouldn't be without them. They've come out with me every single time. Wear and tear.
Yeah. Right. Okay, everybody, hello there. What we're going to do is just cover, following on from the lacerations at campsite, we're now going to cover burns. Burns can be one of the most painful and the most destructive injuries you can have, ranging from intense pain from a burn up to major tissue loss, nerve loss, and obviously disfigurement. As you all know, burns come in different ways. They come through direct heat, indirect heat, chemicals, friction, and unfortunately what's now happening outside is acid attack burns, which is terrible. But what we're going to do today is just talk about campsite burns, how to deal with it quickly, and a few little priorities. So we'll break it into two. I'll show you how I would deal with something on a camp, whether it be overnight or a day, what we're doing now. Then I'll show you how a responding fire or ambulance crew would deal with the burns as well. So the scenario at the moment is Ed has come to me with a burn. So he's put his hand on that handle there, and it's burnt him. So the priorities here to start off with is going to be infection control, and what we're going to do, we can sort a lot of that out by irrigating the wound. Then there's a removal of rings, watches, and any jewellery, and what we'll do, we'll utilise the patient for that. So I'd ask Ed to remove his ring. He knows his own pain threshold, and he'll know if the ring's a good fit or not. So I don't really want to go pulling his hand around. I'd rather get prepared with all the kit. And then what another priority is, it's not often talked about, but it's talked about in professional terms, is keeping the limbs straight. A lot of people will do that in the event of pain, and if it's a serious burn, your nearest burns unit is going to have to try and sort that, you know, via the neurosurgeon, trying to sort that hand out to hopefully rebuild nerves and tendons. If you keep your fingers straight and open, there's no webbing, because skin will unfortunately weld together on a really serious burn. So you need to keep your fingers open and straight. So what we'll have done, we'll have attempted to cool. We've attempted to clean the wound by irrigation. We removed any obstructive jewellery, and by keeping the fingers open and splayed apart, you stand a hell of a much better chance of having any injuries rebuilt and repaired and returning to a normal life, which is the important bit. So the scenario now, Ed has just come up to me. He's burnt his hand, so I have asked him to remove, as I just said, the jewellery. He's kept his hand splayed open. So what we're going to do now is irrigate the wound, but bearing in mind, between us now, we've only got 4 litres of water. Your normal training will be go to a tap and gentle running water for 10 to 15 minutes. We haven't got that luxury, and you may not have that luxury. And even using a water source that's near you, if you are camping near a river, can't be guaranteed that it's 100% good, but it will have a cooling effect. So what we'll do, we'll gently apply some running water, try and
I can confirm that's very cold.
try and limit the flow. Check it. Has it cooled it? Has it helped clean it? Yes, it has. And that's cooling, Ed. The pain's dropping.
Yeah. And it will do, mate, because that's all you're going to have on you at the time.
We are.
Yeah.
So for my personal kit, I'll get a dressing, I'll get my scissors.
And anything here, everybody should have in a standard first aid kit, mate.
Yep,
no,
exactly.
nothing flashing or fancy here, ladies and gents. This is a real world, you know, where we're actually in the forest.
Now the ambulance dressing, you can open it up, you can double it. I would, as it's a small burn, and I would want as much water in it as possible, I would keep it folded. So quick irrigation again before we apply the dressing. Keep your fingers open, Ed.
No.
That's it.
And the casualty probably won't want to do that, mate.
No, there's a way of doing it.
Yeah. Firm but fair. I'm in charge and...
Exactly. So I'm there.
Do what I say or hit you. It's coming around now.
So what we're doing, we're dressing the wound, we're keeping it clean, and we're assisting Ed to keep his fingers open by actually going around the fingers. Bear in mind, this is not under exam conditions and things like this. Is get it on as quick as possible and help the cooling and reduce the infection. So Ed, if you can hold that for me.
Yeah.
I'm not going to mess about with knots. This is 3M tape, by the way. This is what all the ambulance crews carry for securing and bandaging, securing dressing, sorry, and bandages, etc. And also, I've seen people tape to longboards with this stuff, and it doesn't move. So, right, so that's just good. All the loose ends, and now, as we did with the lacerations, back to cooling. I want this dressing as wet as possible. As I just said, for the cooling, and secondly to hydrate the burn area to keep it what's called a viable tissue for the repair side of it.
That is
that soaking now, Ed?
That is proper cold, mate.
Right,
yeah.
that's
no,
cold.
I can see it. Oh, it's
yeah. Right.
Yeah, no, that's it's soaking up the dressing.
Yeah.
Literally, that's how I was taught how to do it.
Yeah.
In the army, mate.
Exactly.
Some things don't really change, do
No,
they?
exactly.
It's the simplest stuff.
But you have to bear in mind that the heat that's in the burn will eventually come back through and it will start to heat up again. So that's when you need to top it up.
Yeah.
No. So that was a minor burn to start off with. So I personally would leave that dressing on. I would give it about half hour and then remove it. I've got spare, so we can always replace it and have a look at it. If the skin has returned to redness, then we can probably carry on with what we're doing. But if it's blistering and it's continuing to blister, then we've got to think about going possibly to A&E, get it checked, or if your doctor's got a minor injury surgery, or if there's a minor injuries unit near you, and then they're going to have to look at it in professional circumstances. So obviously the usual, please don't prick any blisters. That will be done under sterile hospital conditions if necessary, and don't apply any creams or butters and things like that. They don't work, and they actually help to burn the skin. It also makes it messy for the cleanup to do the repairs as well. So that for me is a light burn, campsite. Any more serious, if it's spread, just put another bandage on and reassess it. But that for me that would treat that burn quite well. It's not a serious burn, and it was small, which would simulate a handle from a pot, or
But that's definitely a bushcrafty, get you to hospital way of treating a burn,
Yeah,
mate. Yeah,
that's right.
And we've not used anything that anybody else.
No, and it's just come from a standard first aid kit. Well,
Yeah,
a bit more.
Yeah. Well, yours is a bit more, mate, but it's only we've deliberately done it, so we just, you know, everybody's got a bandage in the first aid kit. Right, is that the?
So if that's reduced the burning effect, we've kept it hydrated. Should it need repair, but I don't think it's going to on a minor burn. But that's reduced the heat.
Definitely, mate. I can confirm my hands free.
and that will also go a long way to keeping the burn infection free as well. So. And
the bandage, I always think a bandage tightness is just about the size, you know, when you're grabbing hold of it, you know, you know, for hand shandy, you know, that type, because the bandage is quite tight there, mate, and that as well. But again, if you finish, mate, I'll just...
Yeah, there you go.
You can't have it under running water, but we can have it under cooling water.
Yeah, that's it.
Fair enough, mate.
Yeah.
All right, so there you go, ladies and gents. If you've not done a first aid course or something like that, it's just a handy little way of clean it, dress it, keep it wet, and evacuate to medical aid. Bearing in mind, if it's a deep burn as well, you'd look for, you know, we're robust puppies, but anybody can come down with a bit of shock, can't we?
That's it. You
know, keep your casualty warm and reassured and all them things. Yeah.
That's it. Right. So obviously Ed said his hand, he touched on a good point there. Ed said his hands was freezing cold, and we're in a cold environment now. So yes, Ed, keep the casualty warm. The silver foil blankets are known to, if you're hot, they'll keep you hot. If you're cold, they'll keep you cold.
Okay.
So the ideal thing now would be to chuck a jacket on Ed, and just keep that hand warm. Wrap a fleece, or even put it in a hat.
Yeah, a shemag,
a woolly hat, something like that,
mate.
So,
yeah.
So yeah, keep the casualty warm, and then we just have to reassess stuff after about 20 minutes. So yeah.
All right, then, like, thanks for that, Al. Yeah, quick, down and dirty bushcraft first aid for a burn, which is highly likely to happen.
That's it. Yeah.
All right, then, ladies and gents, thanks a lot. Appreciate that, Al. Thank you.
So we're going to come back as a professional response now.
Yeah, you're going to do the gels and stuff like that, and that's the only gel or anything else apart from water you put on a burn.
Yes, yeah.
No, it's true,
it's
mate.
Tea tree gel, yeah.
Yeah, there's a few wives still, you know, old wives tell about that. Anyway, thank you, ladies and gents, and I appreciate that, Al. Thank you. Yeah. Call me hands proper freezing, sir.
Right. Okay, just to follow on from the campsite burns treatment, this is what I carry in my truck at all times. It's where we camp is generally close to where the truck is, so I can always get quick access to it anyway. So what I've done here is reproduced a burns kit that we'll carry in the ambulance, but more so what we carried on our vehicles when I was a professional fireman, because we co-responded for the ambulance service anyway. So I've got a range of different burns gels here. There's two firms, Water Gel and Burn Shield, are the main suppliers. And these gels is a cooling gel with a wadding in it, and it's basically tea tree. I don't know if you've all heard of the tea tree. They're brilliant for treating wounds, sterilising wounds, you know, while you're treating it, and it's great for burns as well. So what we've got here is different sizes for different types of burns, sizes of the burns, sorry. I haven't got a face mask one. I used to carry face mask gels on the fire trucks, but this one here is one I've tended to use most, and this is intended for a hand. Absolutely brilliant. So nice and simple, this one. No bandage in the dressing or water. You just tear this off, and I'll demonstrate on Ed in a minute. Tear it off, thrust the hand in, keeping the fingers straight and splayed open, and then we'll just seal the top, but we'll demonstrate it in a minute. These are available from a firm called Medtree in the UK, and I'm going to shoot Ed a link to the firm. I mean, something like these two little ones and a top-up bottle will be absolutely brilliant to keep in the campsite first aid kit. These ones are probably more aimed at the professional, because you could deal with a wound in the way that we just did, but this is what we were carrying on ambulance. Silver foil blankets we touched on, keeping the casualty warm. Tough cuts for actually opening things and exposing burns and things like that. And another little bit I thought I'd show you is a ring cutter. We used to carry these. If the casualty can't get the their ring off with their permission, and we had to get it witnessed that they gave their permission, we would use a ring cutter, because when if you've got a serious burn, the fingers are exposed, the fingers will swell up and cause a great deal of pain, and also if you've got a natural infection risk where any bacteria under the ring. So what we used to do, I mean, it's a simple design that goes under the ring and closes up, and that is a saw there basically, and just turn and turn and turn. Gold and silver rings are not under tension, so invariably you've got to turn the hand around the other side underneath there and turn and cut it into 2 halves. But if you can't get the ring off, that's what's needed to be done. So say these are a range of different dressings. These are nice and simple, the treatment for this. First of all, I'll do a full hand dressing just to show what's in here. But if we, in the circumstances I was responding to a small burn like Ed just had, we would split this packet, apply this gel, and then we will put it into a cling film and lightly wrap around the hand in cling film, just very loosely. That is helps prevent against infection and contain the liquid fluid that we would carry as a top-up bottle. We would squirt that into there and just quickly reseal it up again, and off there. So they're now packaged ready for the ambulance crew to take away. So that's from the professional side, not a campsite burns treatment. So what I'll get Ed to do now, I'm going to need to borrow his hand.
Certainly them 3 bits though there, mate, would make a nice little burns kit for the first
something like that would be absolutely perfect. So
oh, mate, I'll show a close-up of them later on.
Yeah.
Alright, bring you back.
Right, so what I'll do now is just show the treatment of a burn to a hand from a professional point of view. So these are designed for hands. Nice easy guide on there what to do. You can cut it, we never bothered. We used to use the tear lines there. So the idea is that the hand goes in from here. We've got to trust the casualty to keep his fingers splayed open and straight, and then we'll seal it at the top, and they're ready for transport on a serious burn. So what we'll do is I'll ask you to lend me his hand. So we now responded to a burn. Just going to tear it off here, nice and easy. Remind Ed to keep his hand splayed open. Casually, if you can put your hand in there. How does that feel? Cold?
Just a bit. Oh. Just a bit. Oh.
Right, so to keep the gel in and keep it clean, the 3M tape again. I'll wrap round there. And just seal it off. Now, if you can move your hand around in the gel, Ed.
Oh yeah.
Get it all over your fingers. I'm going to gently rub, just to get some of the gel working over. It tends to pull in the corners a little bit, so I'm going to push it into the middle.
It's proper cold, sir.
Things
I do for Hollywood.
So Ed, if you lift it out, you're now ready to go to hospital.
And literally that is it, mate.
Yeah, that's it.
And my hand's proper cold in there,
Right.
so yeah, I can confirm that.
If you start to feel that it's warming up a little bit, the beauty of this kit is I can now open it up, tear the bottle off, pump loads more gel into there, quickly seal it up, finished, done.
And I know you don't want to big it up, but as you just said there one time, sir, you had a plumber. He just undone it, didn't drain the water, didn't do anything.
Rag, yeah.
And he had a massive burn on it.
Yeah.
He got both his hands, mate, and you got to him, and both his hands went in these bags.
Yeah, two bags. Yeah. Kept his fingers.
And he was really blistered properly, mate. Scalding in hot water.
Serious burn.
Yeah. Because again, if the water pot went over or something like that, it's exactly the same as we're doing now, mate. But I'll tell you what, just because I didn't, he said, oh, I don't want to mention it. But the thing is, though, mate, he come back about sort of 2 months later.
2 months later, apart from scarring, he had full use of his hands, and that was a deep tissue burn. That was nerve damage, possible.
And he got told there, if you hadn't had somebody who knew what was what on a decent bit of kit, he probably he would have been in a lot worse situation, mate, with his burns and that. Yeah.
I mean, the neurosurgeon at our local burns unit said that these gels actually saved his hand.
Yeah.
So, and being a tradesman, he needed his hands.
Yeah. So another good skill, sir, mate.
Well, he did it.
Yeah.
So what I'll do, out of interest, I'll show you what these gels are now. And let's say it's a a phenomenon called tea tree. Some of you may be aware of it. The medical profession can't actually say what it does, but it's incredible for burns, infection control, clean up wounds. So if you can pull out that burns gel, Ed,
Yeah.
pull out the whole gel,
Yeah.
and there you go.
That's what it is, mate. It's just like a sponge, isn't it?
Yeah.
Proper.
So when it's actually in the bag, if Ed's fingers are splayed open,
Yeah.
that gel is doing that.
Yeah.
So this is tea tree, this fluid here, in a stabilising gel, and you can smell it. Can you smell the tea tree? There's
Yeah, I know.
there.
It's proper.
Yeah. Yeah.
No, I do like that. Yeah.
Yeah.
No.
So that. And as I say, that's contained in that bag there.
Yeah. And
Absolutely brilliant.
that's what comes out of the smaller ones, mate. Yeah.
Yeah, it's exactly the same, but it's a smaller dressing,
Yeah.
smaller pad.
When you provided the lads with the first aid kits, mate,
Yeah.
like David, myself, and that, you put a few of these in
Yeah.
there, mate, and that's certainly, to put that in your first aid kit isn't going to be too,
No.
you know, just a little burns upgrade,
Yeah.
ladies and gents.
Yeah.
You know, these things inside there is exactly one of these,
Yeah.
but a smaller one. You put it on, and as you say, you cling film around that as well, mate.
Yeah.
Just to keep it all
Just a little
on
bit
there.
of cling film.
Yeah,
Even if you cut this in half and kept it in your first aid kit,
yeah,
just to wrap that. So if you imagine one of these, that's a smaller scale,
yeah.
and then what we would do, it looks funny keeping a bag of cling film in a first aid kit, but we would,
No, it's not funny, mate, at all. You know,
I would ask you to lay your hand there.
yeah. Because again, we're just talking about a smaller one on that original burn on my fingers.
That's
and
it, yeah.
on my palm, sir.
Then I would tuck this around there, around the top, come back over.
We'll just try and cover it for infection control, as you
That's
say
it.
there, mate, and keep it contained.
So that will now be all contained within the
Yeah, and it is.
cling film.
It's even squeezing between my fingers now.
So then, and again, we would top up using the top up gels there. So.
Yeah, that's one, mate. But certainly, ladies and gents, that and that. Handy addition to any first aid kit, mate, if you haven't done
absolutely
already.
brilliant,
And if you drop us a link in there, mate,
yeah.
I'll stick it there. Let your eyes be your guide on that. Just
Yeah.
if you want to go, then just go there. You're going to do a bit of googling and find the cheapest place to get your gels and that,
Yeah.
ladies. Yeah, we're not sponsoring anybody or anything.
Especially relevant if you camp with your family and you've got females. They hate scars and things like that. That reduces the chance of scarring down by a hell of a lot. 80% sometimes.
I mean, it's a
absolutely
cold
brilliant
day,
stuff.
but I'll tell you what, my hand is proper freezing. But that's what you want, sir.
Yeah,
that's
yeah,
what you
exactly,
want.
yeah.
Blimey.
So you've got the cooling gel and you've got the sterilisation of the tea tree. Absolutely brilliant stuff. Can't say how well it is.
Yeah. All right, mate. No, thanks a lot, ladies and gentlemen. I appreciate it, Al.
Yeah.
Thank you, mate.